Hi, I am Dr. Swaminathan Ravi. I am a plastic and reconstructive surgeon at Noble Hospitals, Pune. Reconstructive surgery can be scary for many people, and the information on the internet can be both helpful and overwhelming. So we are here to answer some of the most Googled questions about reconstructive surgery. Reconstruction of the body part affected by cancer, which is removed by the cancer surgeon for curing the patient, is called reconstruction or oncoreconstruction. Commonly reconstructed body parts are the jawbone and skin after oral cancer surgery and also the breast in women. Ideally, all patients who are undergoing any kind of cancer surgery are candidates for reconstruction. As plastic surgeons, we are now able to use the body's own tissues along with artificial implants for reconstruction of various organs. For oral cancer, we use either skin of the thigh or the leg bone called the fibula to reform the lower or upper jaw. Later, dental implants can also be placed in this bone to restore chewing. Skin from the forearm can be used to construct part of the tongue or the cheek following cancer surgery. Skin from the muscle or the back is also used to reconstruct the breast. Even the lower abdominal excess skin is used to reform the breast, which is called a DIEP flap. Such reconstructions are routinely done by plastic surgeons and should be offered to all patients undergoing cancer surgery. Immediate benefit of a well-done reconstruction is that following surgery, adjuvant treatment like chemotherapy and radiation can be given early to the patient with low complications. Also, reconstruction is easiest to do at the same time as the cancer removal surgery, and it is usually done as a combined procedure. Risks and complications are similar to any surgical procedure with very low chances of flap failure. I think here the goal of exact appearance is secondary and the goal of restoring pre-cancer function takes priority. Exact appearance unfortunately can never be restored, but over time an almost exact appearance and function can be achieved. So there you go, the top questions on Google answered. If you feel this information is relevant to you and you wish to seek medical help, come visit us at Noble Hospitals in Pune. Our multidisciplinary team is here to ensure that your health comes first.